My name is Tim Ria, host of Digital Health Live here at the Digital Health Summer Summit, San Francisco 2014. Special guest today is Samir Damani, cardiologist and founder and CEO of MD Revolution, one of our favorite friends of the family. How are you doing?
Doing great, doing great.
So you had an awesome booth space at CES this last year, met your team, really cool product. Give people some background about yourself and then about the company.
Sure, so I'm a cardiologist by background. I formed MD Revolution, which is a software as a service company 3 years ago. And what we do is we basically are trying to move from data collection and data production and technology-focused platforms to actually delivering health outcomes using big data analytics, bringing in the data coming from the technology and coaching people to better health. And our platform now integrates genetic information, lab data, data from digital devices, and we're really working with the pharmaceutical industry, life science industry, corporate wellness programs. So it's kind of running the gamut.
I see Larry Smarr was on your board.
He's on our advisory board. That's right. Yeah, Larry is a great guy. He's a futurist, and so we really enjoy talking to Larry about kind of our product line and kind of where we're headed, and kind of making sure that we're on track with where the future is.
Yeah, he's got an interesting lab down there at Calais.
Yeah, very interesting lab.
So the human equation, cultivating high impact results. What was happening in the panel? Who was there?
Sure. So we had Be Close, which was the other company, which really focused around elderly care, and then you had Kimberly with the company was Vocera. That's right, and they work with health systems and hospitals to actually deliver innovative solutions for patient care experience. And so really it was about exactly what I talked about, is that we need how do you go from high tech to high touch? Right, and high impact. And really it's about how do you take the user experience from technology and actually allow it to generate better health outcomes and better impacts. And so that's really what we focused on with the panel. And we talked about having key pillars of support, enabling, education, guidance within any type of product platform that you build if you're going to be successful within the digital health space.
And what really touched me about MD Revolution is you actually have human beings on the other side of the technology, the platform. It's not just, oh, here's an app, good luck.
Right. Well, if you think about the diabetes prevention program, it's some of the most successful lifestyle intervention programs. They've really stemmed from the ability to have accountability to an individual. And so while you can automate everything within the digital system, the human connection is so important with really sustained change. Any kind of sustained change, that relationship needs to be there. And while that relationship doesn't have to be in person, it can be done via a remote delivery service. And so that's really our platform, is about scaling that personalized, that individualized coaching element, that human connection. It's
really one of the few ways to create scales. You have to have almost telepresence or mobile delivery.
That's right. And so we are very focused on prevention. Telemedicine is exactly right. It's much more scalable, but telemedicine still is focused around the disease-centric model that we fit in, diagnosing and treating, when what we really are about is about 40% of cancers and 80% of heart disease are preventable. Yeah. And these are things that really have to involve participation on behalf of the consumer, on behalf of the patient. And that is all about coaching and really about building relationships and accountability and guidance and motivation and support. And we believe that through the right software platform, you can do that, but you can't take away the human element completely. You got to involve that. And how to scale that is kind of where our secret sauce lies.
Interesting. So what other things rose to the top of the conversation inside?
I'm sorry, what was that?
What were some of the hot topics? That kind of.
Yeah, I think, it seemed like a lot of the focus was around, what are the challenges that we currently face in the market, and a lot of it was geared towards, other entrepreneurs in the audience who might be looking to create a product, create a technology, and how to be successful in an increasingly crowded space. And I felt like that was a really hot topic in terms of the barriers to progress.
And how's the evolution of of MD Revolution happening right now?
We're great. We are slowly establishing ourselves within several industries, and one of the things that we did is we created this model from a research lab first, and we didn't worry about the technology, we worried about how do we create ecosystems around the data produced by these digital technologies, and from there we created the software. And so what we've learned now is that the application, because of the way we created it, is very broad. We can apply it within the pharma industry because they want to access the data from a research perspective to learn about new biological pathways of disease. We're working with other life science companies on joint products that they want to develop. We're working with fitness organizations and fitness chains and fitness professionals on building products to scale personal training. We're working with corporations for wellness programs. We're working with commercial and government payers now because they're looking for more outcomes-based solutions. So, what's really exciting is because what's happening is that even the organizations that were previously not thinking about how to innovate within their own field are having to do so now because of the economics behind the current system, which is unsustainable.
Exactly. So what's your ask? What types of folks are you trying to reach out there?
We're really, we do have a consumer model, but really what we're working, we want to work with progressive entities, whether it's companies looking for corporate wellness, it's payers that are looking for new ways to cap employers' rate hikes for insurance that they're seeing year over year. We're working with state governments. So anybody that really is looking to have optimal patient experiences or consumer experiences dealing with healthcare and are looking at really novel preventive approaches to care, we're really reaching out to those groups. So anybody that's really looking for a new approach that's clinically driven and validated, and we're validating our platform at Harvard. We'll be announcing that shortly, and I guess we're announcing it right here. But we'll be validating our platform at Harvard, and we've got several studies I've already validated. So anybody really looking for clinically validated solutions, that's really who we're looking to reach.
Okay. So how do people reach you?
Just go to mdrevolution.com, and you can reach us through the website.
Well, hey, that's Samir Damani. Always good to have you on the show, and good to see you. Congratulations on moving that forward.
Thank you. Thank you.